it better, sir?
Yes, sir.
Uh, is it okay, sir?
Yes, sir. Yes, sir. Okay, sir. Please continue, sir. It is now clear, sir. The audio is clear, sir.
Clear, na, sir? Okay, okay, sir. Sir, excuse me, sir. Please give the control for the PPT, sir. To anyone, sir.
What, sir?
Hello.
Yes, sir.
Give the control PPT to. Please the control PPT to from your side, sir.
Sir, please share me the PPT, sir.
Okay, I will share it, sir. Just wait, sir. I will share, sir. No problem. Hello?
Yes, sir.
Hello?
Please start, sir. Please start, sir.
Okay, I will sir. Start, sir. Actually, we have delayed for the session for the network issue. I will start my presentation. The topic given is the myology exam point of view. So the topic is been already I was told you. So everybody has an exam fear about the uh, so that's the students are facing the exam in the February month. So you already having the fear of exams, but don't get any exam fear about related to anatomy. So I will start the definition. Some points I will clear here related to the myology. Very shortly, I will going to explain this the related to the myology in exam point of view. First of all, we will discuss about the what is the myology. It is the study of the structure and arrangement of actions of muscles. So, students, you all dissected human body and you've seen the different muscles of a human body, isn't it? Like upper muscles, lower limb muscles, abdominal muscles, head and neck muscles. So, the complete study of these muscles, their arrangement and their action, which deals with the description and along with their accessory structures. Accessory structures means
Excuse me, sir. Anup, sir. It is not audible.
hello, hello.
Huh?
Getting my
Sir, you can continue, sir.
voice? So, of the muscle. Muscles have been classified pharmaceutically under structural functionally as also the structural classification of the muscles. All classified. Morphologically, the muscles are classified that is striated and the striated muscles. Striated muscles are the skeletal muscles and cardiac muscles. In the non-striated muscles, the smooth muscles. The muscles have been functionally the muscles have been classified as the voluntary muscles and the The involuntary muscles, the involuntary muscles are nothing but the muscles which are not under the function of these muscles not under our control. Those muscles are considered as the involuntary muscles. The example for this involuntary muscles is the peristaltic movement, the smooth muscles we can take, and the cardiac muscle. Basically, we can take the cardiac muscles example for this one, which are smooth, and the cardiac muscles, which are responsible for breathing, heartbeat, starting movements of the intestines, constrictions, contractions of blood vessels, and many other vital functions are under the control of these involuntary muscles. So, number of times the question repeatedly on this question on this point. That's why I'm repeating the point. Next is the skeletal muscles and the cardiac muscles. The structurally skeletal muscles, how they have been classified. The skeletal muscles are nothing but the muscles tract and the urinary bladder. That means the muscles are responsible for the pumping of the blood or the cardiac activities which are there in your performed by heart, that is under the control of these cardiac muscles. Okay, which are coming under the heading of the smooth muscles, and the gastrointestinal tract muscles, the muscles which are in GI system, that is stomach. We can take the muscles are connected to the stomach, smooth muscles of a stomach or mucous membrane of the stomach and the urinary bladder. Means what is the digestive functions of human body is there. That is under the control of these smooth muscles. So based on that one, we can say these muscles are located in the lines of an excretory ducts of an glands, in the walls of an blood and the lymphatic vessels and the visceral organs. So this is about the smooth muscles. Basically, what we can understand about the smooth muscles, these are totally performing the function, the vital functions, or which are responsible for the human body. Next classification is the cardiac muscles. On our screen, these are the striated muscles across stations. Means muscle fibers, they are striated, these are arranged in a manner, irregular masses, and these are also involuntary in their action. Means the functions carried out by these cardiac muscles is also are not under the control. These are characterized by the muscles are intercalculated disc branched first and the central nucleus. Important application feature of this muscle, this nucleus is centrally placed and these are having the disc and the fibers are branched one. So the name itself indicate cardiac. Cardiac means the muscles which are in related with the heart itself. So that's why what is the important function of the heart is there, that is the contraction of the arteriums and the ventricle, arterial and the ventricle wall of the heart, those are under the control of these cardiac muscles, and because of that only whatever our rhythmic contraction and relaxation and we are hearing the heartbeat, that is under it is because of the movement, the contraction, the relaxation of these muscles, and because of this muscle only the circulation and the pumping of the blood is possible throughout our body. And name itself indicate these are present on the walls of an heart, specifically in the myocardium. So this is about the basic classification of the muscle, that is skeletal muscles, smooth muscles, and the cardiac muscles. Also we can take the voluntary muscles and the involuntary muscles. Next, just in brief, I will tell you about the morphology of the skeletal muscles. Why? Because sometimes they may going to ask the question in the exam, explain about the skeletal muscles in the short answers. For example, for the 3 marks. So at that time, one should write it down about its what is the origin, what is the insertion, and how it is present. Means structurally, what the skeletal muscle will have. It will have the muscle belly and it will have the tendon. Means its origin and the insertion of the muscle is tendinous one. Okay, and centrally the muscle have the belly. So in this diagram it is clear for you people, the bone, the scapula where they have been named, the origin and the insertion. In between these two there is a belly of an biceps, where we can say the muscle, that is we can say the muscle belly, and where it will take the origin and the insertion, that is the tendon. At some extent or at some point it is also called as an aponeurosis. So what is the origin and what is the insertion? Sometimes the question may going to ask in your exam at a define origin and the insertion. So what is the origin here? The less movable of the two, it is the point which is less movable, and there is a two attachments in the limbs, and this is usually the proximally. Means when already you studied the anatomical terms, what is the proximal, what is the distal, what is the distal, what is the movable. It is less movable. It is maximally more movable than that of an origin point. It will also have that two attachments in the limbs, which is distally one. See, the origin point of a muscle is proximally attached, whereas insertion point of the muscle will attach distally. So in this diagram, we can see here the origin and the insertion. I'm moving the cursor here. So this point you can see the origin point and this is the insertion point. So the in between these two will have the belly of the muscle. This is the belly of a muscle. So this is the point which we can say the less movable and it is the more movable. So the origin and the insertion. So the next point, what is the action of the muscle in the limb? Okay, depend on their we can say depend on the how they are joined to the joints, how much number of joints are involved in the attachment of that respective muscle, what is the shape of a joint. Based on this only the action of muscle is dependent. Okay, so which will result into the different action, for example extension, flexion, rotation, abduction, adduction, and circumduction. These are the commonest action performed by the muscles in the limbs. Either you can take the upper limb or you can take the lower limb. Okay, so what is the flexion, what is the extension, that already we know. But sometimes the question we're going to ask in the short question, short answer related to the anatomical terms like the flexion and the extension. So it is a muscle action. How it is possible through the muscle? If the muscle is located on the side of the limb towards which the joint will bend, okay, that means it will decrease the angle between the two joints. It will decrease the angle between the two joints. So in this diagram, we can say here, this is the elbow joint where I'm moving the cursor. This is the angle at the point of insertion. This is the angle of an elbow joint between the arm and the forearm. So here the arrow is moving upward. That is nothing but the flexion, moment of flexion. So when this angle is reducing, this is to be known as the flexion. How it is possible? Based on the attachment of an muscle where it is attached. Where it is attached. That is in number of joints involved, the shape of the joint, and all those things. So that's why the example is given for this one. Biceps brachii is the muscle which will help for the flexion. So this is the flexion action of a muscle. Next movement of a muscle is extension. It is dead opposite to the flexion. That means if muscle is located on the opposite side of a flexors, that means the flexion is reducing the angle, extension will increasing the angle of an elbow joint. Just revert to the flexion. That action we can say the extensor, and it is possible because the muscle is located opposite to the flexor muscles. Okay, that is the extension movement. Next comes to the adductors. If muscle which tend to pull the limb towards the median plane, means when our body is at the median, we want to turn at the one side, definitely our hand is moving in towards the median plane, inward movement of an arm, and that is because of the muscle is pulling towards the median plane. If somebody will pull you by stretching your hand opposite to the one side, then that movement, if muscle, is known as the adductor movement. Next will comes the abductor movement. That is also dead opposite to the adductor movement. If the muscles that tend to move the limb away from the median plane, then that action is known as an adductor. So these are the commonest actions performed by your muscles. That is flexion, extension, adduction, and abduction. So, and after the moment of the after discussing about these actions of the muscles, we are going to go for the what is the muscular arrangement. The muscle fibers are grouped into the fascia, that is the bundles. The muscle fibers are arranged on the different bundles, and they are arranged in that manner. They are grouped together, and based on that only, the muscles have been classified as the pinnate muscles. They have been classified based on that only as the pinnate. If the muscle fiber coverage on a tendon at an angle, so this is the tendon. In this diagram we can see this is the tendon. The muscle fibers are running at the angle of a tendon, so that is known as the, and based on that only the muscle is forming the pinnates one. The muscle fibers coverage on the tendon at an angle. This arrangement allows more bundles, thus that will help for the stronger contraction but less shortening. Here pinnate muscles are helping for the pinnate muscles are more stronger for the contractions, but these are less shortening because of the shorter length of an muscle bundles. Example for that one is the gastrocnemius muscles. Okay, I don't want to go in that one detail about the gastrocnemius muscle because already all of we seen the muscle while doing the dissection itself. So because of the shortening of the less short muscles, these are helping for the stronger contraction, and based on that only the muscle has been grouped into the unipinnate, bipinnate, and the multipinnate muscles. So what is the unipinnate muscles? A pinnate muscle whose tendon runs along with one side. Along with the one side, you see here the diagram is the one side. both the sides of that particular tendon, it will form its structure as a double-sided one. So that's why this particular type of a muscle is called the biceps muscle, whereas this was the multiplicated muscle. So this is the multiplicated muscle, where the muscle fibers are running in the multiple directions towards the tendon. So that's why this muscle is called the such type of muscle is multiplicated muscle. So this is the basic the muscle. So now I think everybody has understand if the person if the person in the exam will simplify the muscle explain it mathematical to this application you have to write it down. All the classification, their definition, their and the diagram. So that will help you to write it down. So along with that, certain more exam actual structures are there along with the muscle. What are those structures? What is the fascia? Why is it why are going and going to the fascia that is used in that particular the particular structure and it is not the biology. But after the particular ask the exam as a fascia, difference between the fascia and ligament, difference between the ligament and the tendon. Okay. Like in the next slide, I will show you how what are the repetitive ask questions in the ordinary university exam. The previous concept. Okay. So what is the fascia here? It is a connective tissue membrane separating the muscle from each other. The fascia is a structure which will separate the muscle from each other and allow the partner to be the muscle in a particular position. Because of the presence of the fascia only, the muscles are minded in a particular position. That first primarily the fascia is divided into the superficial fascia and the deep fascia. When you get the difference between
Anup sir? Sir, you are not audible.
hello.
Anup sir, you are not audible.
Hello. Hello.
Yes, sir. Now you are audible, sir.
Shall I continue?
Yes, sir.
Okay, okay. I will continue. No problem. Okay, thank you, ma'am. So, I was there in the classification of the muscles. Now I am going to show discuss about the accessory structures coming in the along with the muscles. First is the fascia, ligament, and tendons. Each other and binding them into this fascia. It is a tissue member will complete binding muscle that will separate muscle from each other. Example of interface in between the radius and the ulna. That will help you for the separation of the muscles and the fish the bind that muscle into a particular position. But the muscle fascia has been divided into two, that is the superficial Next, we'll get the deep fascia here. Next, I will tell you about the ligaments. What is the ligament here? It is a short band of flexible fibrous connective tissue which will connect the two bones or the cartilages and holds together joints. Means what are the joints are there in our body? Those are interconnected with each other through the ligament. It is a fibrous connective tissue, and because of the presence of ligament only, we are able to perform the functions, that is the flexion, extension. What are the muscles? What are the functions we discussed earlier? Okay, that is abduction, adduction, and all those things. Next is the tendon. The tendon is very important structure in the muscles. Why? Because the origin and the insertion of a muscle is the tendinous only. That is, it is flexible but inelastic cord of a strong fibers, strong fibrous collagen tissues which is attached to the muscle to the bone. And this tendon may be sometimes short, maybe the long, depend on the muscle. That is the if the muscle is long and short. That's based on that only the tendons are present here. Now, very important. This all the points which I will discuss till up to this one. These are related to the muscles. Apart from that one, as the basic topic is the for the exam. How we are going to prepare for the exam related to the muscles or in commonly. First of all, first we have to before starting your exams, understand what has been asked. Particularly in the myology, we'll get confusion when will the question has been asked. That is the flexor group of the muscles, extensor group of the muscles. Number of times students may get confused, or you will get confused that it is a part of a dissection why they have been asked in the theory examination. But totally you can take in your mind that one. Even though we are performing the dissection, that is also a part of an your theory syllabus, and that's why you have to understand what is been asked in the questions. That you should understand. Flexor, flexor group of a muscles, and for only I will give the one example, quote one example here. Flexor group of a muscle and the extensor group of a muscles. Just one F and E is there, which will give the confusion for us one. Okay, if we'll read that complete question very fast, and instead of flexor group of a muscle, you have written the extensor group of a muscle. Definitely, your mark you are going to lose your mark. So that's why very important thing to write in your write the exam. Before writing the exam, first you should understand what the question is there. Okay, next only the answer the questions. Don't write other things irrelevant to the questions. That is, do not include any irrelevant material. If you are known to the if you know the correct answer, then only you can write in the and attempt that particular question. Why? Because it is a muscles is just like a study of muscles is just like a mathematics. Okay. So, for example, if the deltoid muscle you ask in your exam, if you have written any part of hip bone like origin and insertion in the femur, definitely will going to lose your mark. So that's why don't write irrelevant answer. Okay. Most important is that next point is that one. Understand the format in which your answers are required. It is most important while writing the muscle part in your exam. Later on, it's essential to you the part which is essential to answer the related muscles. And very important in it's very important, and the repetition of revision of a previous question paper is also important for you people. That is also very important. If the question is long, you should write it. You should take more time, and if the question is small, you should take the less time to attempt the questions. So it is very important that one studying 1 year is one criteria, one thing, and writing the exam for 3 hours is another point. Why? Because whatever you have studied in complete whole year, you have to represent within the 3 hours. If you have studied number of times, but you are unable to represent in your exams, that will lose your that will not even score, and you will lose your marks. So that's why the management of time is also very important while writing the exams. Next point, use the flow charts and the diagrams, which is very important aid to write the anatomy. Okay, Just for example, if any muscle, single muscles has been asked for in your exams, for example, just I was drawn the diagram here in the slide, biceps brachii muscles. If the muscle has been asked in your exam as a biceps brachii for the 2 marks or the, sorry, 3 marks and the 5 marks, you should draw the diagram of that particular muscles. At the start of the topic, write down everything you already know about the subject. Don't forget to write, don't leave anything while writing the exam. What is the best preparation then during the closer to your exams? Transformation of your revision notes. If you already prepare the notes, you have to transform those notes from one person to the another person, that increase your that the in the diagrams, in the diagrammatic manner. That's why you have to practice the diagrams also. In that matter, the visual remembrance can aid to your readiness considerably while when taking the exams. Means whatever you are writing, that should be transformed into the diagram. Always the diagrams are very important while writing the anatomy and while preparing the anatomy exams. So next is practicing of an old exam. That is already I was told you, revision of the previous question papers is also very important to see about the to know about the FAQs. That's why practicing as old exam is also important. So what you can do in the last 10 minutes of your exams, check if you attempted all required number of the questions. How many questions are there in your question paper? First you check all the questions where you are attempted or not. Check your number of attempted questions. Next, check your answer sheet and correct the it is not essential for us because grammatical and spelling mistakes are very common in other subjects, but it is not needed for you people. So next, if you have still more some time, then draw the line in between the two answers. Now it is not possible. It is not required for us because Rajiv Gandhi University will providing us the answer booklets with the question numbers. Where you are getting the question number, there you have to write it down the answers itself. So next, foremost important, what are the frequently asked question in the previous question paper on the myology? These are the different questions which have been asked in the exams. Based on that only today's topic I was covered in the today's presentation. That is, first question they have been asked, difference between the smooth skeletal and cardiac muscles. If the question is this like this, it has been asked for the 5. This is the question of 5 marks. So direct question is very direct one. That is difference between the smooth skeletal and the cardiac muscles. But you have to write it down, the definition of the muscles. You have to prepare the. You have to write it down the smooth. What is the smooth muscles? What is the structure of the smooth muscles, and where these are located, and what is the function of a smooth muscle. In the same manner, you should go through the skeletal muscles and the cardiac muscles, which is the involuntary. Among these three, what are the involuntary? Which is which is what voluntary muscles? What is their connection? Next question. The next question is also long question. Muscles of a rotator cuff. Okay, this is also repeatedly asked question. Flexor compartment of an forearm, extensor compartment of an forearm. About this one, I will tell you in the next slide. Next, they have been asked about the deep fascia and its modification. What is the deep fascia? They have been asked, and what are its modification? The visceral attachments of this deep fascia also you should write it down here. Next, the individual, there may be chances of asking the question in the exam, the individual muscles. For example, the triceps brachii, hamstring sartorius muscles, pectoralis major muscles. These are the biceps muscles, the muscles of the flexor carpi, radialis, flexor carpi ulnaris. These are certain muscles which are going to ask in the short answers for the 3 marks as the individual muscles. Apart from that, a certain group of the muscles are there in your body, that is hamstring muscles, the flexor group of the muscles, extensor group of the muscles. Those muscles shall be there in their group. So that's like that you have to answer the question. Next, for a foremost example here, the next slide will come. If the question has been asked for the 5 marks about the only one muscle, very important for you people to remember this one. Okay. For example, I was taken the example for here as the deltoid. It is one of the most important, and there may be the chances of asking this deltoid muscles in the long question. How you have to write it down? Okay, this is also very important. First, you should write down its origin, its insertion, its nerve supply, action, along with the diagram of an deltoid muscles. The complete this type of matter is present in your answer booklet, then it is possible you will going to get the marks. Okay, so like that, along with the deltoid muscle, there will be the chances of biceps, triceps. Okay, pectoralis major, pectoralis minor. These are the certain long, big muscles which are going to ask. Even the gluteus muscles also they are going to ask for the 5 marks. So at that time, you should write it your answer like this only. So how you have to study the muscles? Already everybody known that is the BD in BD Saurashya, they have given the charts in the chart manner. Like that only you have to prepare for your exams. What is the through the regional wise means upper limb muscles. Again in upper limb muscle you have to divide yourself. That is muscles of an back, muscles of an forearm, muscles of an arm, and the muscles of an palmar muscles. Again you can go with the muscles of an thorax. Similarly, you can go with the lower limb, that is the gluteal muscles, the muscles of an thigh. Again, the thigh has been divided to the different three medial compartment, anterior compartment. Based on that only, you should divide your muscles of an the calf muscles also we can take. So like that only you can divide your muscles and prepare the chart, but the based on that only, but that is the its origin, its insertion, and the action. If possible, then remember the nerve supply of the muscle. But everybody has to know about the origin and the insertion and the action of particular muscles. So like that only you have to prepare for the muscles. So prepare, you have to prepare the chart and you should write it down your study room for the easy understanding, and repetition is also very important while studying these muscles. So this is about the today's topic which is given for the presentation, and I will give you the all the best for your exams and prepare well, and thank you for giving me an opportunity for the presentation to the organizers.
Thank you, sir, for sharing your expertise with us. On behalf of Department of Sharir Rachana, we are very grateful to you, sir. Thank you.
Thank you, ma'am, and
Tomorrow,
thank you to the organizers, and thank you, madam.
thank you, sir. Tomorrow, on 27 December 2020, we have Dr. Nitin Kumar, sir, Associate Professor, SDM Ayurveda Medical College, Udupi. Sir will be talking on the topic Ayurveda Sharira Rachana. So thank you one and all for attending in this guest lecture on exam orientation program Avadhana 2020. Thank you.